Welcome back to the show. Are you someone who struggles with maybe some pain in your spine? Well, the Spine Center at Valley View is the perfect place to go. And I'm joined by PA Eric Strauch. Good morning, Eric.
Good morning. How are you?
I'm wonderful, and I'm excited to learn about how people can prevent or help themselves with some spinal injuries, because I'm sure that's something that you see quite frequently.
Absolutely. So we take care of neck and back problems all day long, every day.
Yes.
It's extremely common pathology. We were designed with discs that lose their blood supply at a very young age. So the disc is the shock absorber of the spine, and as it loses its blood supply to the inside of the disc, sometimes by the age of 8 or 10 years old, it starts to dehydrate and degenerate. So the inside of the disc, which acts as a shock absorber between the bones, transfers the stress to the wall of the disc. It was never designed, the wall was never designed to be a shock absorber, so it can tear. And then a common condition might be where jelly comes out of the jelly-filled donut, hits a nerve, causes leg pain. So there's a lot of things we can do to strengthen our spine, which includes Pilates, all kinds of core stabilization, using good body mechanics when we do things. Unfortunately, we all don't do those things, but we still participate in outdoor sports and activities, or even daily activities, and tend to tear our disc walls, causing issues. And we're here for those people who don't get better with simple remedies like physical therapy, chiropractic care, etc. And we provide spine surgical evaluations all day long for cervical as well as lumbar spine.
And so the Spine Center at Valley View is a great place for people to come and kind of have you help them evaluate what's going on with their spine. So can you give us a little bit on what Valley View is and where it's located?
Yeah, so Valley View Hospital is a nonprofit independent hospital in Glenwood Springs. The spine clinic there is run by Dr. Felipe Ituarte, who's an excellent surgeon, and I'm humbled by the opportunity I've had to join them a few months ago after practicing spine surgery here in the Vail Valley for about 25 years.
Wow. And
I call it a gem within a gem, because Dr. Ituarte brings me back to my roots. I worked here with Dr. Corman since 1998, joined him, and at the Stedman Clinic we had 20 years of developing the first comprehensive spine program in the mountains, really teaching mountain communities that spine surgery can be done in the mountains. And he retired in 2020, and at that point we had accomplished what we intended to accomplish. I stayed on for a couple more years and then joined Dr. Felipe Ituarte, who brings really the same values that I'm used to, back to my roots with Dr. Kornman, which is time with patients, time to diagnose carefully, time to educate a patient about what is causing their spine issue, and time to talk about all the different treatment options, from conservative options to surgical options when necessary. And that's actually how Dr. Ituarte runs his practice. We are well-staffed with easy access to the whole community, regardless of insurance or ability to pay. We take care of all comers with spine and neck problems, with back and neck problems. And we give them the time they need to take care of them. So we have 3 PAs on the team, physician assistants. I'm one of them. We have 2 nurses. We have a spine director. We have Dr. Ituarte running the team as the surgeon. We have 2 interventional pain management physicians who do a whole full array of injection type treatments for the spine. And it's a fantastic clinic, and it's within this hospital that serves the community, with a vibe that all are in the game for the exact same reason, which is to take care of the community as their mission states, one person at a time.
You know, as you're talking about it, the word spine surgery sounds awfully intimidating. Are there a lot of misconceptions around having spinal surgery?
That's a great question, Maddie. I appreciate the question. In the old days, at cocktail parties, when people are talking about their neck and their back pain, or at barbecues, patients always say, or to each other, friends say to each other, stay away from spine surgery, it's a last resort. Well, in the old days, that was probably true. Complication rates were quite high. Technology has come so far. When we put a screw in the spine now for a fusion type surgery, which is not always necessary, there's decompression type surgeries, which are much simpler to take pressure off a nerve and try to relieve a patient of leg pain, or if it's in the neck, arm pain. But when we do need to do fusion for instability or a very degenerative disc where bone is grinding into bone and a patient has terrible back pain that they can't live with and they failed conservative treatment, we can guide our screw in the spine now with navigation technology, which Dr. Tuarte uses, as well as robotics. So we do use robotics at Valley View Hospital to help make surgery as safe as possible. And it's come a long way. So when we see a patient, most patients don't need spine surgery, and we're happy to see them even though we're a spine surgical service. We give them a full array of options. And so if you came in with severe leg pain, we would talk to you about whether surgery is necessary. We would identify the problem. And if you have pressure on a nerve, the only indications for surgery when you come in with leg pain that's generated from the spine would be if you have pain that you can't or don't want to live with after failing some conservative therapies, or if you have true motor weakness where a big muscle in the leg is not working well. Anything short of that, we can try to treat you conservatively, and nerves do have the ability to adapt to pressure. And if they adapt to pressure and the pain goes away and you don't have significant weakness, you don't need spine surgery. And we're happy to try to get you down that pathway versus spine surgery. But when we do spine surgery, the complication rate is extremely low. So we try to take some of the fear out of spine surgery. One thing I like to add is in the lower back, there's no spinal cord. The spinal cord stops behind L1. It becomes a sac of nerves called the cauda equina, which are the nerves are this big. We can actually move them a centimeter in each direction under a microscope if we need to. And there's no cord in the lower back. So when we do low back surgery, the risk of paralysis is virtually zero. Most patients don't understand that. It takes a little bit of the fear out of spine surgery.
Which I think is so incredible for people to know, because as we're sitting here and you're saying, if you have arm pain, it could be from your neck. That's something I've never thought of, even though I know that there are so many nerves connecting everything to one another. And so what a great way for people who maybe are suffering with some pain
Sure.
to go, oh, it's not my hip, it's maybe a nerve that I have somewhere in my back, and you guys are the experts. So it would be great for them to come and spend some time and have you go through the steps, and that way they're not just going 0 to 100.
Without a doubt. And along those lines, Dr. Tuarte's team, because we're so well staffed and because it's so important, we give patients a lot of time. So if you came saw me or Dr. Tuarte or one of the other PAs, you might get a half hour or an hour to take what is necessary to make sure we figure out the exact pain generator. There's an old saying in spine surgery, half the battle takes place in the office, half the battle takes place in the surgery. So if you end up needing spine surgery, you need to have an excellent, talented surgeon like Dr. Tuarte to perform the surgery. At the same time in the office, we have to make sure we have the right diagnosis. I saw a patient recently who came in with leg pain. They did have some pressure on a nerve, which is not uncommon after the age of 40 or 50, even if it's non-symptomatic and maybe irrelevant. But their pain, and carefully talking to them, was just from their knee down to the outside of their foot. And they were told by a spine surgeon out east that they needed spine surgery. They came to me for a second opinion. And upon careful history and physical, if you tap out here, you can figure out that the nerve might be trapped in the knee itself, called perineal neuropathy. There were no symptoms in the upper leg. And even though the MRI of the spine showed some pressure on a nerve, it actually was irrelevant. It wasn't the cause of the problem.
Wow.
But they were booked for surgery already on the East Coast with a surgeon who didn't take the time in the office to try to figure that out. And it's not that you have to be smart to do that. You just have to be caring and take the time. And that's something we do focus on in our practice, is giving patients time that they deserve and the respect they deserve to be seen carefully.
Now, you said at the beginning of this interview, there are a lot of things that you can do to prevent some of these moments that could happen, whether it's the fluid coming out from the gel coming out and getting on the nerves. You can do Pilates, you can do yoga, you can strengthen your core. Now, if someone is struggling with back pain or hip pain or maybe shoulder pain from any of these nerves, when is the time to come see the spinal surgeon?
Yeah, so indications to see a spine surgeon. Indications for spine surgery, even of the patients we see who are coming in with neck and back problems, arm pain or leg pain, most of them don't need surgery. The indications for surgery in our practice are, again, when you have a pinched nerve with true motor weakness, sometimes when you have significant pressure on the spinal cord and you develop a condition called myelopathy, which is when you start losing balance and you start losing coordination in the hands. And that happens because of a progressive pressure on the spinal cord from degenerative changes. Short of that, pain that you can or don't want to live with, motor weakness from a pinched nerve in the neck or the back, or pressure on the cord, most conditions that patients come to see us for, surgery is elective. So you have a choice, and we give you that choice. We say, you have a problem, you have terrible back pain. We have identified that it is from either a very degenerative disc here, or maybe from the facet joints that are supposed to act as doorstops. If they get arthritis in them, on a side view, one vertebra can slip forward on the other. and that can cause pain and some mild instability that's not dangerous but painful. And we can do a fusion surgery, and then we tell them all about what they're up against if they decide they can't live with it. But we also give them the confidence that it's not a dangerous condition. The degenerative disc is not dangerous. A mild instability is not dangerous. You can ski, you can mountain bike. A lot of patients have it and don't even know they have it. But we tell them how we would fix it, what the risks are, what the benefits are. We have that careful conversation. And then we really talk to them about, can we manage it? Have we tried physical therapy? Have we tried chiropractic care? Have we had them see Dr. Caleb Seal or Dr. Gyura Han, both very talented injectionists who can put some steroid around certain structures to decrease inflammation? And then we tell them, when it comes time that you can't live with it and it's affecting your life, you want to have surgery, then we talk about the surgical fix in a little bit more detail. But indications for surgery or to come see a surgeon are really if you want information about a spine problem that's affecting your life, your ability to function in the way that you want to, you're welcome to see us, and we will give you your full array of treatment options from doing nothing to conservative treatment, physical therapy, injections, Pilates, etc., to surgery.
Eric, we are all out of time, and I have so many more questions, but I want to thank you so much for coming and spending the time with us this morning.
Thank you so much. I'm really looking forward to meeting with you again, and thanks for having me on the set.
Of course. Make sure that if you're someone struggling with some slight spinal issues, whether it's a pinched nerve or whether you could have just slipped a disc, the Spine Center at Valley View is the place to go because the experts down there are absolutely incredible. We're going to take a short break, and when we come back, we've got more of the show.